Hello everyone, I'm Dr. Rajesh. I'm child specialist in Apollo Noida Hospital. I'm working here as a pediatric consultant. Today we are going to discuss a very important topic that is on normal development of child versus delayed development of a child. So first of all, we have to look what are the normal development of child and how it varies from the delayed development. So we have to first of all learn that what are the delayed developments. Like every child does a particular activity and developmental skill at the particular age. So these are well defined at certain ages. So if the child does everything, the skill wise or the developmental wise, the certain procedures in the age manner, then it is called the normal development. But whenever baby or child lags behind from the normal developmental milestone, then it is called delayed development. So when a child does not perform the developmental skill motor wise, sensory wise, language wise, or cognitive wise, then it is called delayed development. So now we will discuss one by one that what are the causes of delayed development, and what first of all we have to know that what are the normal developmental milestone at certain ages, and then we'll go for the risk factor for the developmental delay, then how the parents know that their child are delayed development wise, and then how it can be tackled by parents and doctors, and then ultimately where this child has to be referred. So first of all, the normal development age wise, I just tell you. So when the child becomes like developmental delays happens in multiple domains. Like there are gross motor delayed development, there could be fine motor delayed development, there could be social and behavioral cognitive delayed development, and another could be the speech or language developmental delay. So in every manner, like in every domain, if the child is delayed, then it is called global developmental delay. And global developmental delay means there is alarm, and the parents and the doctor has to take initiative early, and they have to deal the every aspects of the delayed development one by one in the same manner. Like when there is a partial delayed development, like in one domain, like in motor development or in gross motor, fine motor, or in speech or in language or social behavior, then the alarm is not that high, and we have to tackle that domain of the delayed development systematically. So first of all, like what are the normal development age wise? So if you'll go by motor development, so first is at the age of 2 to 3 months, the child holds the neck properly. Then at 4 months of age, like they hold the neck as well as move 30 to 60 degree in both sides. And at the age of 6 months, normally the child uh, sits with supports, and without support they can sit at around 8 months of age. Likewise, at 10 months to 12 months, they stand with support. At age of 14, 12 to 14 months, they stand alone without any support. इसी तरीके से अगर हम देखें तो जब बच्चा 15 से 18 महीने का होता है, तो दे कैन वॉक इंडिपेंडेंटली और विद द हेल्प. अगर वो 2 साल के होते हैं, तो वो दे कैन one step they can reach on the ladders, like stepwise. When they become even more older, like 3 years around, they can ride tricycles with the support, and at the 4 years of age they can hop, and around 5 years of age they can do all activities as a normal child. So the same way, like in fine motor development, at the age of 6 months, or 4 months to 6 months, they hold the hands, they proceed the hands, the whole hands. Right hand preference will be always there to any objects. Around 6 to 7 months, they put the both the hands, they can hold the objects in one hand, transfer one hand to other hands. The same wise, at the age of 12 months, around 9 months, they 9 to 12 months, they pick the things, small things, with the whole hands. As they grow towards the 12 months, they can pick which we call pincer grasp by 2 fingers. So these are the fine motor development they can do age wise. In the same manners, they can wash their hands at the age of 2 years. They can dress and undress. They help in dressing and undressing around the age of 3 years. So if you go by language skills, so a child can at the age of 3 months can coo, and at the age of 6 months, or they babble. At the age of 9 months, they start speaking single monosyllable or bisyllable words. The same way, at the age of 1 year, they generally speak bisyllable words like baba, dada, papa, mama. And at the age of 2 years around, they can speak two words with a meaning, they can make a sentence. At around 3 months, they can tell stories, and they can make small stories. So these are the language development. Social wise, or social or behavioral skill, if you'll go that from the beginning, like from the age of 3 months or 4 months, they watch, they have develop social smiles, and they sometimes move from soundable objects, they can move towards the toys. Likewise, at the age of 9 to 12 months, they start speaking jargons which they only can understand. It is, but they speak something which is not understandable by adults. This, as the age grows, like around 2 years of age, 18 to 24 months, they can make a cube of 3 cubes. At the age of 2 years, they can make 6 cubes. So these are the normal development. We cannot go in very detail of that because it will take too much time. So how we can say there is a child is not doing things right at the right age? We will have to classify that the development is delayed. So, develop what are the risk factor when we can say that these childs can in the long term go in delayed development? So, risk factor could be genetic, familial, like if the child is having syndrome, if the family is having Down syndrome or any other kind of syndrome in the family, so obviously the intelligence and all will develop, and the neurodevelopmental disorder can happen in the later on. Likewise, in the environmental factors also contribute, like mother has not got nutrition properly around the second or third trimester of pregnancy, and if mother develops any infection around the pregnancy, then also it can affect the developmental milestone of the child. So if the mother is emotionally or psychologically deprived, then also it can lead to developmental disorders. Anything which these are the like prenatal. If we go postnatal or natal, then also, like if there is any catastrophic event at the time of delivery, like HI, where there is a birth asphyxia, child didn't cry, then also it could lead to cognitive as well as motor social delayed development. If the child, because of any infection, developed meningitis like seizure activities, or child was put on any drugs which is anti-epileptic kind of drugs, then also there is a developmental delay. If the child is having any metabolic disease which has been detected early and is on therapy, then also because of this metabolic diseases, child can have delayed developmental later on. Same like degenerative disorders sometimes can delay the developmental milestone later on stage, like HIV or encephalitis due to chicken pox, like Wilson's disease and some kind of chorea disorder. Then that also can lead to developmental delay. If the child is having some hearing problem or in vision problem, that also can lead to delayed development. So these are the risk factor where we have to, the pediatrician as well as parent have to be aware that these child could lead to delayed development later on. So there are few red flags where we can know that the child is going in delayed development. So for that, parents have to notice every developmental milestone is happening or not regularly, as well as they have to go and check the all the developmental, get it checked by doctors at all vaccination visit. Initially, vaccination visit happens every month or every 2 months. So by the age of infancy, it is well detected by the pediatrician. But even after that, mother or father has to be that if there is any sign that child is not up to the mark or is getting delayed by in any domain of the development, then they have to inform the pediatrician, and so that timely due activity or due counseling treatment has could be taken. Now, few red flags where the mother can know that, or parents can know that there is a delayed development. So, like if baby or child doesn't pay attention to parents, long staring to the usual activities or objects, then it's also a red flag. Get easily frustrated or violent behavior happens in the later stage of age, then it is also a red flag. Like aggressive behavior or stubborn behavior, if the child is showing, and talk to self doesn't mix up, then also is an indication of cognitive or social behavioral developmental disorder. The same wise, if the child is from the beginning is very stiff, having a stiff arm and legs, and or is very floppy and limp kind body postures, then also is a red flag. If the child is doing everything but doing in a very clumsy manner, then also it is a red flag. Vision wise, there are some red flags, like if the child is rubbing eyes frequently, and there is a difficulty in the following objects, then it is a red flag. Difficulty in finding objects, picking some small objects when they has to do pincer grasp activity. If they are not doing, then there is a suspicion of any visual impairment can lead to delayed development. Difficulty in eyes contact from person to person, then also it is a red flag. If you go by hearing, so talks, if the child is talking too loudly or very softly, then it is a red flag. Difficulty in understanding small instructions, then it's a red flag. Difficulty in responding when the child is addressed or called by name, then it is a red flag. So these are the red flag where parents can very well know that their child is lacking behind. So there are some tools which we pediatrician generally apply for screening of these delayed childs. So these are Battelle developmental inventory scale. The other is Bailey infant neurodevelopmental scale. The another is child develop inventories, and the good one and the latest one is the Denver develop screening tools. So these are the tools by which uh, we can diagnose, we can even level the delaying of the child milestones. So these can be done by these scales we usually do is by direct observation of the children as well as parents interview. There are few questionnaires asked to the parents, and they have to answer, and according to their response and our observation we generally diagnose the delayed development, and even accurately can say that how delayed the developmental milestone are. Now, in the last, I want to say what are the intervention which we generally do for. So first of all, if there is a global developmental delay or very large developmental delay is happening, then we as a pediatrician has to send the babies to the pediatric developmental neurodevelopmental specialist. They are very specialized in detecting, treating, counseling the delayed developmental child. So, in which there are multiple teams where the counseling is done at multiple level. Even parental counseling happens. The training with every session, they train the child in every manner. Like if child is having motor developmental delay, then they have to train in the same way. Physiotherapy as well as occupational therapy goes simultaneously. If there is a nutritional lacking, then nutritional support along with the medical and nursing care is also available there. Behavioral and psychological therapy are also done when there is a cognitive delayed development. So, in a nutshell, uh, we as a pediatrician as well as parent has to be aware that their child is falling in the risk of the delayed development child. If yes, then they have to be alert that for the delaying milestones. If they find that there is obviously a developmental delay in every domain or in some domain, then they have to report. Then this child will be clinically examined and properly treated and counseled. So, in a nutshell, we told everything about the delayed development. And thanks a lot for